Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about an interesting fact about TMS. So, one of the cool things that TMS does that's very different than ketamine is ketamine kind of gets in and does the whole brain all at once. But it sort of peels back things like layers. So, you might be dealing with depression, and then that peels away and it's anxiety. You might be dealing with anxiety and that peels away and it's depression. But one of the really interesting things that we do with TMS is if you're specifically focusing on depression, there's an area for that. If you're specifically focusing on anxiety, there's an area for that. If you're specifically focusing on OCD, there's an area for that. So, unlike with ketamine for TMS, there's a very specific targeted area for these different mental health conditions that we can really get in and work on with the BDNF excitatory conditions of the TMS machine in a very, very narrow, very focused way. For example, we can place the TMS coil over very different parts of the brain and have very different reactions. And it's a really exciting area of medicine because I think it's much, much more attuned to working on one symptom in a very narrow and focused way, whereas ketamine kind of gets in there and handles a lot of things, but is a little bit more blunt a tool than the way that the TMS paddles focus on different things.